Hello everyone, I'm Dr. Wiquar and I'm a consultant pain physician at Alleviate Pain and Spine Center, Bangalore. In my previous video, we had discussed about shoulder joint, the common pain generators around the shoulder joint and its anatomy. Today we'll be discussing about the application of ultrasound in diagnosis and in interventions. See, shoulder joint consists of a scapula, clavicle and the humeral. The articulation between the humerus and the scapula is your glenohumeral joint or the shoulder joint. It has also got a acromioclavicular joint. It's got a rotator cuff. The rotator cuff helps in the stability of the joint. With that, we also have got few bursas. Bursas basically means the space between two muscles is covered and the cushioning comes from this bursa. That also can be a pain generator. In the diagnosis and in interventions, we use ultrasound. We have got Sonosite, and which is one of the best portable ultrasound machine. For the purpose of ultrasound, we will be using ultrasound of the shoulder. We will be using a linear high frequency probe because all the structures around the shoulder joint are quite superficial. The rotator cuff, there can be tears, partial tears, there can be bursitis, there can be adhesive capsulitis. So all these things are even acromioclavicular joint arthropathy because of degenerative changes, and the intervention, something like a suprascapular nerve, can be done under ultrasound guidance. It becomes more easy and more precise. Now I'll be demonstrating the sonoanatomy and the probe position. For the purpose, we'll be using a high frequency linear probe. First, we'll be seeing the biceps tendon. This will be the probe position and this will be the position of the hand. For subscapularis tendon, we can move a little medial. Next, we will be seeing the rotator cuff. That is the supraspinatus. In this position, we'll be seeing supraspinatus, and we can also visualize the subdeltoid or subacromial bursa. This is in the anterior aspect. There is also a joint which is the acromioclavicular joint. The probe position will be like this. Posteriorly, we will be seeing the shoulder joint. That's the glenohumeral joint, the glenoid labrum. As well, we'll be seeing the infraspinatus. Now we'll go to the sonoanatomy. Basically, we'll start off with the biceps. This is the bicipital groove. This is the biceps tendon. And this is the transverse ligament. Continued together with the tendon of the subscapularis. This is the subscapularis, which is again a part of rotator cuff. In any tendon, what we see is if there is any, if it is hypoechoic, or the color, if there is any partial tear or any bursitis. This we are seeing a supraspinatus tendon, and we are seeing the deltoid muscle, and we are seeing a subdeltoid bursa. In this case, we can do a examination and we can also do therapeutic injection or a diagnostic injection, where under ultrasound guidance we take the needle at this place and we can deposit within the bursa, or we can deposit within the tendon. We can deposit PRP injections. This is the acromioclavicular joint, where the clavicle and the acromion of the scapula come together. You can see the joint. If there is an effusion or the fluid is more, it will be like that, and there will be degenerative changes which can happen. In this case as well, we can go in plane or out of plane and inject the local anesthetic as a diagnostic and a therapeutic. This is the humeral head of the arm, the humerus, and this is the glenoid. So if we are having a patient who is having frozen shoulder or adhesive capsulitis, in this position from posteriorly or from behind, we will be coming from this angle and getting into the joint. And we can, even in case of arthritis, we can deposit if we are doing a hydrodilation or a diagnostic injection. we can deposit it within the shoulder joint. One more thing which we can do with ultrasound is a suprascapular nerve block. Suprascapular nerve, it passes on the top. So we hold back and we can go in plane and deposit close to 5 ml in the fossa so that we block the nerve and the patient has pain relief, and it can be helpful for the patient to mobilize or do exercises. If you have any queries regarding shoulder pain or any other pain, you can call us or give us a visit. Thank you.